Welcome to another edition of It's Your Health. Philip Benyo with Philip Benyo. We're here to take you into the next phase of medical knowledge. Make sure you check with your healthcare professional before doing any of the things we talk about here on It's Your Health. Right, Fipster?
That's right.
All right, we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Be right back. Welcome to the first segment of It's Your Health. Hopefully spring has sprung. It's been a brutal winter that we've all been nursing and getting ready for, and we have a plethora of knowledge to plow through today.
We're not going to plow because that reminds us of snow. Let's kind of rake or seed through. Maybe that would be better.
Maybe cornucopia might be better. But why don't you get us started there, Phil, on some headlines.
All righty. The FDA approves a new COPD drug. GlaxoSmithKline recently gained approval for a new COPD inhaler that is a once-a-day inhaler called the Breo Ellipta.
We like these inhalers because they work. Sometimes you have to take them twice a day, and some people actually forget the second dose. So this once-a-day thing will do the same thing as the twice-a-day thing, and look forward to using it because with COPD, it's obviously a frustrating illness, short of breath with exertion and cough.
Or they could stop smoking. But we'll get to that later. Moving on. Diabetes in middle age may cause memory problems. They've shown that diabetics, especially uncontrolled diabetics who are in their 40s or 50s, end up having early age-related memory issues.
Well, keep in mind that diabetes, of course, is a vasculopathy. That means it affects all blood vessels, ranging from your toes to the ones in your heart, to your eyes, and of course your brain. And so that the smaller blood vessels, if they become clogged or you're not getting enough blood supply, of course you're going to have impairment of that organ.
Yes. Lastly, stress-linked protein may play a role in Alzheimer's. They found a protein in the brain called the REST protein. It stands for something much longer. But increasing amounts of stress in our older individuals deplete this protein, which causes early degeneration in the brain.
I'll tell you what, this whole dementia stuff is an epidemic, if you will, and this may play a role in it because as we age, unfortunately, it seems like there's more stress in one's life, and life is a little bit more difficult, especially after this winter, to get through between paying oil bills and just trying to get around and maintain a house, extended families and the like. And of course, people are living longer, which is a good news, bad news story. They're living longer. And of course, you live long enough, you really will get a dementing illness, up to 90%. So, big problem.
Well, let's talk about some other new things. You know, we're making big transitions down. Patients who are coming in for yearly physicals are coming in, they're seeing, some new staff, they're seeing computers in our office. We're now part of what's called Alliance Medical Group. How's that change been for you?
I've welcomed it and enjoyed it. I think we're able to care for more patients on an extended level. We have a little bit more staff. We're now EMR'd, which means we're computer networked, no more paper charts to fool around with. I think we have faster turnaround times on getting back to patients their laboratory tests. And overall, it's just an easier way to practice medicine. The one thing I'm a little discouraged about is, I grew up with the corner grocery store where you dialed the phone and a human answered the phone like that. And now you got to press a few buttons to get in the right place. And sometimes our elderly may not listen or hit the right button, and that can be frustrating, especially since we were kind of a ma and pa setting in the past. But if you can just put up with that, bear with us. Hopefully we're going to be bigger and better as time goes on. And keep in mind that with Lehigh Valley Network behind us, the health network, all ships will rise, I think, in terms of specialty care as well. Philip, what are your thoughts?
I think it's really exciting. We've already had a lot of very interesting changes, and I think as we move forward to the completing the merger with Lehigh Valley, we've already had access to specialists that we really had a hard time with. You know, the hospital, we now have access to infectious disease specialists. We now have electrophysiologists coming up on a weekly basis, and these are things that people had to travel out of town, and the people who needed it were people who were elderly and had a hard time getting out of town, and now we'll be able to offer these services here, and I think that's just the tip of the iceberg.
Right. And keep in mind, within a couple of years, we'll have a new hospital here.
That'll be exciting. It'll be a shorter drive. I'm excited about that. Moving on, we're in spring. Let's talk about some spring-related issues. Some of these are very common problems every springtime, but it seems like they sneak up on us real fast. Let's talk about allergies. What else?
I can tell when it's March and April because without question we see an uptick in things like allergy, seasonal rhinitis, that runny nose, dry cough, itchy eyes. We see an increase in reflux symptoms.
Absolutely.
And without question, we see an increase in anxiety and depressive issues. It seems like whatever emotional background was stable, it reawakens. And the same thing that is pushing sap up trees and making the rabbits run around, it's getting lighter earlier, it stays lighter longer, and that's an activating agent that we sometimes have trouble trouble getting through. And you notice that too, don't you, Phil, in the patients you see?
Absolutely. You can tell it's a spring, and I was crazy of March hare has nothing to do with rabbits. It has to do with people and how they get. This time of year we probably prescribe more medications and deal with more anxiety and depressive issues than any other 4 or 5 months combined.
Right.
It's really amazing, and it's a very repetitive, predictable phenomena. Even in patients that you wouldn't even think would know it's necessarily spring, that it is a truly light phenomena. It's like someone in a nursing home who may not have all their mental faculties, they may have dementia, but yet they still get nutty around this time of year.
Yeah.
So it truly is it's a seasonal phenomena.
Right, so just keep in mind if you're not quite right, it could be some seasonal stuff, and check with your doctor.
Is that our first segment?
I don't think so. I thought we were going to talk about some new drugs.
Oh, that's right. Well, let's talk about 3 new drugs quickly.
Go ahead.
There's 3 new diabetic drugs on the market. One is called Nesina, and this is a DPP-4 inhibitor, very similar to Januvia or Onglyza. There's another one called Tradjenta. It's a new medication. What's exciting about this is not necessarily the drug by itself, but the combinations they have. There's a second one called Kazano and a third one called Oseni. These are combo drugs, which, cut down on pill burden. The second one, Kazano, being a combination of the DPP-4 inhibitor and metformin, which we use all the time.
Right.
And the last one is a combination with Actos or pioglitazone, which is starting to gain a little bit more ground since some of the controversy it saw a few years ago. Some exciting new combinations, something you'll be seeing more and more of. This one's a little bit slower to come to the market, but we're excited to start using them.
Yeah, again, there's so much help for diabetics out there, but you also have to help yourself and remember that you need to get your eye care done, you need to get your foot care done, because it's an all-encompassing disease that requires very close follow-up and management. And that will wrap up our first segment of It's Your Health. I told you it's the fastest half hour in television history. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo. And I'm telling you, when patients come and see us having not seen us for a couple of months, the first thing they say is, God, your son looks great. He's lean and mean and he's trimmed down. And suffice it to say, they ask, well, what is he on? And he's on nothing. What he's doing is basics, diet and exercise. And Phil, maybe you could elaborate on your renaissance.
Well, I definitely found that, the really key is that you are what you eat. And if you're putting healthy vegetables and healthy lean meats in your body and staying away from processed foods, things that need to be wrapped, things that never spoil, there's a reason for that. And so trying to stay away from a lot of the chemicals, I think, has helped. Trying to eliminate high fructose corn syrup, which to me is a very evil word. But also exercising regularly. You need to exercise 3 or 4 days a week. One thing we also started doing in the gym is we started doing yoga. And I got a lot of laughs at that initially, but yoga's been a very beneficial, very helpful thing in my exercise experience as well as my life experience. It has helped me in the mind and body. You know, we've had a wonderful time. We have a wonderful yoga instructor that comes meets us weekly by the name of Dina Stewart at Love Your Life Yoga. And I think for people who have back injuries, neck injuries, or have all kinds of fitness problems, or even some relaxation and stress problems, it's been a wonderful technique to help address all those issues.
Well, everyone has noticed, and
I'm not sick. That's what a lot of people think. In fact, I'm better than ever.
very
Let's
good.
get back to some headlines.
Speaking
here.
of better than ever.
Okay. Oddly enough, more muscles linked to longer life.
Oh, there we go. What a segue.
Well, some studies have shown, mostly in older adults, having a little bit higher concentration of lean muscle mass leads to vitality, and it will help you live longer, as opposed to being very thin and not having those bigger muscle groups.
Yeah, we said it before, you don't use it, then you're going to lose it. And I think the easiest thing as we age is to just simply go walking. And I think walking, even if you want to carry some small weights with you, that's going to be your best and safest exercise, because sitting around just using the remote, that's going to not work.
Absolutely. Wider waistline means shorter life. This goes to not just about fat or obesity or weight. This has to be about where your weight is, and we've talked about that before.
Some about belly fat is a different fat, and it's a more evil fat and can lead on to things like diabetes and hypertension, bad things. And so whether you're a pear or an apple, that is to say, if you're a pear, you have the fat on your rear end, that's a little different than the fat around your belly, which would be the apple. Treatment's the same though, right? You got to just do what you're doing.
Yeah, you just got to really, for people who have belly fat, and that's where I carry it, I say that fat is anything but lazy. You know, that fat is doing a lot of active things to try to kill you, and so you need to really fight harder than you would if you were carrying that fat in some other places. Lastly, even slightly higher blood pressure increases stroke risk.
Yeah, you know, in the old age, it was the first number, which is when your heart's beating. The systolic was allowed to be 100 plus your age. That's kind of gone by the books. So the really want lower is better. However, one caveat, and that is the elderly. They've now relaxed the idea that we need to have a 70 or 80-year-old have a blood pressure of 120 over 70. They become a little bit more of a fall risk, lightheaded, dizzy, especially when going to the bathroom. We've relaxed the blood pressure parameters on the elderly, but the young, lower is better. So you really need to keep that in mind. Sitting out there with the blood pressure 130 over 80, we now consider that pre-hypertension, which goes on to hypertension, by the way. So that's really a silent killer, and we really need to focus in on blood pressure, because it's a vital sign, and they call it a vital sign for good reason.
And it's what we do. We spend, other than coughs and colds, the number one thing we see or treat is high blood pressure. It's a third of what we do. And so it's linked to so many other disease states. It's pretty important to get ahead.
It's like overinflating a car tire. You're going to wear out sooner and, God forbid, suffer a blowout.
You've been smoking through the car tires lately, haven't you?
That's right. Another winter issue.
No fun. Alrighty, let's kind of transition, to some of the healthier things we can do, and almost redact some of the things we've said in the past. When we talk about what oils are healthy to cook with, what oils are not healthy to cook with, and we always used to say vegetable oil is something that's healthy to cook with, and we should always, if we could, use vegetable oil. Well, what does that mean?
Well, I think that's another one that's gone by the books. I might personally use olive oil. Am I on the right track?
That's the right thing, because vegetable oil, we don't know what vegetables are in there. And, some of the vegetables are good for you and have healthy fats, and some don't. So vegetable oil has a high concentration of soybean oil, which is high in omega-6s, which is not healthy.
Right.
If you choose something like canola oil, or olive oil is probably one of the best, that's higher in the omega-3s, which, from our fish oils, we know that that's really good for you. And the omega-3s are what have anti-inflammatory benefits and have a lot of health benefits.
No doubt. Anything else I should be replacing in my kitchen with?
Well, you should start having more chocolate, but we could talk about that a little bit later.
I'll tell my wife that.
Let's talk about a little different controversy while we're talking about health and things to help us feel younger. And, there's a big controversy right now with testosterone. There's a lot of commercials on TV for testosterone replacement. Is your T low? Get your T checked. And, When I started working, I never even checked testosterone levels, and now I check them every day. And how do you see that in the years practice you've been around?
Right. It's now an epidemic, and to some degree, perhaps the media has fed this. Low T, low testosterone does, in some individuals, cause symptoms, which is why we're going to measure it. And it doesn't always have to do with the bedroom per se. It could be you're tired, weak, depressed, lost your get up and go, put on some weight. And there is a male menopause, if you will. So by measuring that and correcting it safely and under physician's guidance, I think we can improve your lot in life, again, besides just being in the bedroom. Where we get into some controversy is with the injectables, which of course we don't use, or over-treating you and not following you. And if you have risk factors for stroke and heart attack, adding testosterone may add to that risk. So if you're older and need testosterone replacement, that's an issue. If you have hypertension, diabetes, smoke, or at risk for stroke and heart attack, we may not be pushing it that much. And I think that's where the controversy comes in. Some individuals over-treated their testosterone level and ran into trouble. So again, it's a drug that has to be monitored, and we personally have not had any issues with it.
No, that's just it. You have to be careful. If and that's the classic example is the hypertensive diabetic male who has heart disease. He comes in tired, but he doesn't want to accept that the first 3 problems I listed have nothing to do with his fatigue. We find his T's a little bit low. He wants testosterone, but that's going to increase his stroke and heart attack risk.
Right. So not for everyone. But I'll tell you what is for everyone. It's your health. And we're going to be right back after this brief commercial message. Remember, it's your health. We're your leader in healthcare information. Be right back. Welcome back to the final segment of It's Your Health. Boy, it really goes fast there, Fipster.
That's right. I was on another show and he tried to say that, Dr. Kislin tried to say that that's going to be the fastest show, but he's wrong. This is the fastest show. It always will be.
It's slick.
All right. Scientists probe dark chocolate's health secrets. They actually found that dark chocolate is metabolized by some different bacteria in our stomach that produce chemicals that are very healthy for us.
Yes, my wife Kathleen will love to know that. And we usually do have some dark chocolate around the area. And I think, again, it's everything in moderation. The less refined it is, of course, is going to be your better deal.
Moving forward, the 5-second rule may actually apply.
I love this.
This is the silliest thing.
What is the 5-second rule?
Well, the 5-second rule is if you drop something on the floor, as long as it was not on the floor for more than 5 seconds, you can go ahead and eat it. But, I don't know if I dropped an open peanut butter sandwich on the floor, peanut butter down, I would apply the 5-second rule. But what they actually did is they tested it, and that's what we do in medicine now. If we just have a theory, why don't we just test it? And a microbiologist actually looked at how long it took food to get bacteria attached to it, specifically E. coli and staph, which are 2 bad bacteria. And the longer the food sat on the floor, the more likely bacteria got stuck on it. So keeping it under the 5 seconds is relatively safe. I can't believe I'm saying that. I hope my kids aren't watching.
I hope my government taxpayer dollars didn't fund that study. But so if you get to something, something falls on the floor and you get to it before 5 seconds, you can probably eat it.
I think we categorize this under news of the odd, because I don't know that I would still, while I've read the study, I don't know that I'm going to apply it to my daily living.
All right, well, let
if
the
an
buyer
M&M
be,
hits the ground and, maybe, who knows.
let the buyer beware, especially if you have dogs at home.
Yeah. The FDA approves a new diabetic medication called Farxiga. Have you heard of this?
No, tell me more about it.
Well, Farxiga is actually the second drug in the class of the glucose transporters. Your kidneys normally try to hold on to glucose or sugar and keep it in your bloodstream. And in diabetics, as that sugar rises, that becomes more problematic. What this medication does is it actually safely transports sugar across into the urine so you excrete it. And you can excrete to about 21 to 30 grams of sugar a day, which is a couple hundred calories. And it helps lower your blood sugar, and it has an added bonus of weight loss.
Wow, that is What can go wrong with this medication if you push too much sugar out of your kidney?
Well, what can happen actually, it doesn't necessarily hurt the kidneys, but it's from having sugar in your urine. So, sugar is a lovely food for all kinds of bacteria and yeast. So women tend to have higher incidence of yeast infections as well as urinary tract infections. So that's the only thing we really have to worry about. We of course monitor kidney function, but there really aren't any issues with kidney function. Whereas an uncontrolled diabetic who is transporting sugar across their kidneys, they have terrible kidney function.
Right.
It's very interesting how they figured out how to do that.
It was interesting. I was having dinner, and it was in a non-smoking area, and this person was smoking. And suffice it to say, it turned out to be an e-cigarette, which is kind of...
We have patients that come in and smoke them in the rooms. It's amazing.
So what is with this e-cigarette, Phil? What is this stuff?
Well, this is kind of a very new industry, and it's also an unregulated industry. But the concept is that we have nicotine liquid. And we'll say, well, cigarettes are bad, you're not allowed to smoke. It's smoke that's bad. We're burning a leaf and creating all these things. But there's a lot of other chemicals as well. Whereas e-cigarettes, it's nicotine liquid that is vaporized, not smoked. So there really isn't anything being burned, it's more of a fog. And so the idea is that, for the smokers, the idea is, well, I'm not smoking anymore, I'm using nicotine. And is it any different than a patch or a nicotine gum? And while in essence it is not very different from patches and gum, because it is nicotine replacement therapy, the interesting thing is no one ever bills it as a way to quit smoking. And there's a lot of problems with it. A, they're not tested. Nobody really knows anything about these. They're not regulated, so the concentrations of this liquid can be toxic. And if you spill this liquid, or your child gets a hold of this liquid and drinks it, it's deadly. It's very dangerous stuff. It has to be diluted and properly handled. And the scary thing is these are things you can just purchase online in gallon drums. It has a lot of problems with it, and I think the biggest problem is it makes nicotine much more accessible.
Right.
And it's much more concentrated, which just creates a higher addiction to nicotine. Giving a smoker more cigarettes doesn't help them quit smoking. That's what we've essentially done with e-cigarettes. And so I caution people with them, that there's something that we are very new, that we really don't know a lot about.
And there are nicotine receptor sites in our brain, if you will, and these things get lit up and get actually, I want to say, reproduced. They become more intensive, if you will. So the more you smoke, the more nicotine receptor sites have to be fed. And so when you try to withdraw, these are like crying babies, which call you back to the nicotine. So you're absolutely right. And keep in mind that there's additives and chemicals and fragrances, which again are
Absolutely.
sort of unregulated, and who knows what's in them. So it's not a safer alternative, despite what you might hear. One of the things I wanted to touch base with, Phil, is we see patients in the office who complain, I forgot where I put my keys, and I forgot this, I forgot that. I can't remember that lady's name. And I think they're concerned about, am I becoming demented? Am I going to have a dementing illness? Am I getting Alzheimer's? They have some memory issues. How would we approach something like that?
I think that's a big, we talk about Alzheimer's, and Alzheimer's is increasing in incidence, and most families know someone who has Alzheimer's and see how rough it can be, and there's a big fear out there. And I think what's very interesting now, we're actually talking about different things. There's a much earlier condition called mild cognitive impairment, which we'll say MCI for short, that is not necessarily Alzheimer's. And this is someone who may just forget their keys, or may forgot why they walked into a room. And it is something that increases with age, but it doesn't necessarily cross over to Alzheimer's. And that's where the research is right now. What do we do for these people who really don't have Alzheimer's? They have mild cognitive impairment, but is there something else going on? Is there something we can do to prevent them from transitioning over to Alzheimer's?
Well, again, if you just forget where your keys are, that's one kettle of fish. If you look at them and say, what are these for? That's a different issue altogether. And again, the more Alzheimer's dementia patients who we see start getting personality changes beyond what you would see just with aging. And there are personality changes, they throw in the memory issues. And keep in mind that sometimes it could be a sign of some other issue. For example, your thyroid may be off, you may be becoming a diabetic, your B12 levels may be off. Sometimes we can find things such as depression, which is a treatable condition, which could explain some of these symptoms. So when in doubt, check it out. And speaking of checking it out, we have to check out now because it's our last segment of It's Your Health. Thank you so much for allowing us to come into your home, hopefully inform and entertain you. Remember, you're watching It's Your Health. We're your leader in healthcare information. Thanks again.